So testicular cancer is rare, and it mainly happens in men between the age of 20 and 50. Usually the main signs and the way people present is actually finding a lump in one testis. Incidentally, during examination, we always encourage young men to check for testicular cancer, and it's very easily recognizable when it's there. Occasionally also men present with pain or discomfort in their testes, feeling of heaviness, some changes in the scrotum, and these are all warning signs of possible testicular cancer. So most men actually know when they are they could have testicular cancer, because I say the person or the men themselves feel the lump. So they present to their doctor, who will undertake an examination and then refer them accordingly. Once they come and see a specialist, we will examine them as well. We'll perform series of blood tests, including tumor markers, who are very helpful in the diagnosis, and also we perform very urgent ultrasound scan on the spot to either diagnose or rule out testicular cancer. Occasionally, we might send the patient for a CT scan of the body in case they have cancer, to check that they do not have any secondaries or metastases. There are no real causes for testicular cancer, but there are risk factors. And the main risk factor is what we call undescended testis. And these are men who their testis does not descend during birth. As you know, the testis initially during fetal age is an intra-abdominal organ, and they descend into the scrotum with birth or right after that age. So this is the main risk factor. Obviously, there are some other risk factors, such as exposure to radiotherapy and chemicals, but usually it's undescended testis that is the main cause that we look for. With testicular cancer, surgery is the main cure. So it's considered in nearly all of the cases, in a very minority of patients where they present with severe metastatic burden, i.e. the cancer has spread into other organs and is causing a life-threatening symptoms, which is very rare and happens probably in less than 1% of the cases. Those patients go for chemotherapy first, but the main cure is to have surgery, and that is a very quick day case procedure performed by a small incision and to remove the testis and the cord for clearance of cancer. So luckily, testicular cancer is a very curable condition, and more than 95% of men with testicular cancer are clear in 5 years. This is very good, and it's true in both mild, early and intermediate risk patients. Even in highest risk patients, the cure rate is more than 60%, and that is using chemotherapy agents, and luckily they respond very well to that, and therefore, yes, it's a very treatable and very curable condition, and therefore surgery on its own, with or without chemotherapy, is very effective.